So next we'll start with the patterns of acute inflammation. The first pattern will be the serous inflammation. Serous itself means some clear watery fluid is there. So the edema fluid which came out right during the vascular permeability, so that is the one which is going to cause the serous inflammation. So usually you see it in effusions. Effusions are fluid accumulation inside the body cavities. So effusions are an example of serous inflammation. Apart from that, a skin blister which we see. So post some burns, you get some skin blister, right? Next is a fibrinous inflammation. So fibrinous inflammation, as the name suggests, it is going to contain fibrin along with the fluid and inflammatory cells. So fibrin is a product of this coagulation mechanism, right? So fibrin clot is going to form. So that will give a thread-like consistency. So rather than being watery, this consistency in the fibrinous inflammation will be somewhat thread-like. And here the classical example again will be fibrinous inflammation seen in the effusions again. Effusions. And also we have some fibrinous pericarditis. So fibrinous pericarditis, we see it in many conditions, especially in rheumatic heart disease and Dressler syndrome. So Dressler syndrome is post myocarditis pericarditis. So in rheumatic heart disease, this fibrinous inflammation is going to be given a special name called as bread and butter pericarditis. So this thread-like consistency is the classical feature of fibrinous inflammation, which is formed because of the presence of fibrin. Then suppurative inflammation. Suppurative means some pus-like material is going to be there. So pus or purulent fluid is going to be present. So there will be lots of neutrophils in this. So examples of this will be abscess or even an acute appendicitis. So abscess is localized collection of this suppurative inflammation only.